Managing chronic diseases for homebound patients is a full-time job. Important health information and vital signs must be checked frequently, and medications have to be taken appropriately in order to maintain a certain level of health. This can be a tall order for many patients who often find themselves in the hospital over something that was completely avoidable. In fact, studies show that people with chronic diseases account for 75% of all hospital admissions, resulting in unnecessary and costly medical bills.
We spend billions of dollars in this country every year on management of chronic disease. It is far and away the biggest expense in healthcare today. It is paid for by Medicare, which is a huge cost to the federal government, by Medicaid, by private insurance companies, and sometimes by individuals who have to pay for their own care.
As rising healthcare costs trickle down to the consumer, emerging technologies are providing cost-cutting solutions that also help patients better manage their health. Electronic medical record keeping has found a voice literally in something called Telehealth 360.
Please say the top number of your blood pressure or enter it using the keypad on your telephone.
Patients can key in via their telephone vital signs and other important health information.
Patients simply receive a phone call according to a schedule. Could be once or twice or 3 times or 4 times a day, either to remind them of their medication intake or maybe doing a clinical assessment. Information that is inputted through the phone goes directly to their electronic medical record, analyzed, and according to set parameters for each specific patient, information will go back to the healthcare provider, whether the nurse, the physician who is monitoring this patient.
In the event of abnormal results, instant alerts are sent to the patient's medical provider, allowing for timely intervention, avoiding hospitalization and ER visits.
When problems and adverse events happen with patients, it's happening immediately. It's transmitted immediately. I can troubleshoot, I can pull up their history snapshot, I can look at their medication profile. It also facilitates if I have to call a doctor, because I have all of that information right there, and it's all happening in real time while they're on the phone.
Before I got on the system, I'd go to the hospital approximately 3 times a year for pneumonia and blood pressure and other things. Since I've been on the system, I have not been to the hospital to this day.
What we know is that people with chronic illness can live very healthy lives. You know, if they eat well, if they get the right kind of medical treatment, if they keep their blood pressure under control and their blood sugar under control. One way to do that, the way that we know really works best, is this concept of relentless follow-up, regular feedback, not just a quarterly visit to the healthcare provider, but daily information about their blood sugar, about their blood pressure, about their goals.
Our hefty healthcare price tag continues to be one of our country's biggest hurdles. While the debate over how to fix it continues, technology is offering solutions in areas we would least expect. Telehealth 360 is changing the way healthcare providers remotely monitor their patients' health at a fraction of the cost of other telehealth systems in the market today. No complicated or expensive hardware, no maintenance. You just need access to a home or cell phone.
There is nothing intimidating about utilizing the telephone. There is no training required. There is no technician to come to the home to set up any equipment. There is no maintenance. There is no insurance. It costs about $19 for this technology to be used per month versus a little over $100 for the other technology. It uses telephone, which is very familiar to a patient and can be intergenerational, versus the other machines are digital machines, very hard to use, very hard to communicate with, and therefore it's much easier. It's all about the data. It's not about how fancy the gadgets are.
For the patient, it's as simple as receiving a phone call. Vital signs and health information are entered using the keypad or patient voice. The information is transmitted instantly to the healthcare provider, and intervention can occur on the spot, avoiding unnecessary hospitalization and ER visits. This unique approach to disease management keeps chronically ill patients in the comfort of their own home without compromising the quality of care.
Once this becomes a routine for the patient, then the patient can really live their normal life, receive their calls daily, and start living day to day without the hassle of being labeled diabetic or having COPD or having, hypertension.
They could do a very low-cost investment that could change significant amounts of cost, and that's upstream thinking, preventing things before they happen instead of waiting until people are so sick they're in the hospital.
For those who are on call and receiving the real-time alerts, Telehealth 360 is enhancing the way they get their job done.
We know our patients, we know their health problems. So every time they've called, I found that it helps me out immensely. And our ultimate goal is for comprehensive health care and prevention, so we don't have to send them to the hospital unnecessarily. The feedback that I get most often is a sense of security. All the while I'm decreasing anxiety for the patient. They're on the phone, they know somebody's out there to help them.
It was very easy to learn. It was very simple. You just pick up the phone, you dial it.
For patients and healthcare providers alike, including physicians, I believe Telehealth 360 provides a peace of mind, meaning information is delivered immediately. There is no chance of losing the data or the information. There is no chance of losing time. Hospitals even can reduce their expenses because if a patient gets admitted to the hospital twice within 30 days, hospitals don't get paid. And therefore, it is to their benefit to keep their patients out of the hospital on a system like Telehealth 360 to prevent the rehospitalization or revisiting the ER.
Telehealth 360. Less cost, more access to care, anywhere, in real time. For more information on what Telehealth 360 can do for you, visit us at telehealth360.com or call the number on your screen.